Good morning, everyone. I got my Virginia contingents. Illinois, Florida, Cape Cod. Okay, good morning, everyone. Facebook is waking you up a little bit better today than it did yesterday. Who knows? Yeah, it's a little nutty. So there was a question in the Friends Who Like Judy Morgan DBM Facebook page yesterday. And so I think the person had their dog neutered, and good for them, they had pre-op laboratory work done prior to surgery, which is always recommended no matter what the age of the animal, because it was amazing to me how many times we would do lab work on what appeared to be a perfectly healthy 6 or 8 month old animal, and we would find something kind of earth-shattering, like, oh my gosh, this animal's in kidney failure, this animal has liver enzymes through the roof. And it's not something you certainly expect to find on a young animal, but sometimes you do. So it's definitely worthwhile to start having laboratory testing done at an early age. So if you're not planning on spaying or neutering and they're not going in for surgery, then I would recommend when they go in for their first annual exam after they get through the puppy and kitten stuff, that you just have a even a mini blood panel run to just get a baseline for what is normal for your pet. But one of the problems is that this person did have the lab work done and had the neuter done and everything went well, and then they got a copy of the lab results and they looked at it and said, well, a couple of these things are not within the normal ranges that are given on the printout. And it was one done on an in-house lab machine. I'm not as happy with those as I am sending them out to a large laboratory where things are definitely more specific. The testing, when you send it out to a big lab, they're testing their equipment all the time. They make sure that everything is running correctly, whereas things that are in-house, sometimes there's a little more user error, that sort of thing. So, but she got the lab results back, and some of the parameters were outside what the machine printed out as these are the normals. What her veterinarian did not explain to her with some of those things that were outside the normals is that the normal values that are given are normal values for an adult animal. And they're species specific as well. So the person who's running the machine has to put in, this is a dog, this is the age of the dog, it's a male or a female. They have to put those parameters in so that the machine is kind of comparing apples to apples. But unfortunately, most of the machines do not have normal parameters for young animals, puppies and kittens. They just have parameters for an adult animal. So one of the things that came up out of the normal range were the lymphocytes in the white blood cell count. Well, young animals are going to have higher lymphocytes. That is normal for them. They're neutrophils, which is the white blood cell scavengers that run around and eat up bacteria. They're part of the immune system. Those are going to be higher than the lymphocytes by about 1.3 to 1 to 1.5 to 1 in a normal adult animal. But in a young animal under a year of age, that can be skewed in the other direction, and the lymphocytes can actually be higher than the neutrophils. So she was very concerned that, oh my gosh, my dog actually has something wrong, and the veterinarian never mentioned it. And I think she had lost another pet to cancer not too long ago, so she said, I want to be really proactive, and if there's something that's not normal, I want to jump on this right now. So I was able to keep her from jumping off the cliff by saying, no, that's really normal for a young dog. And maybe her veterinarian knew that was normal for a young dog, but didn't explain it to her. And the problem is you guys are now asking for copies of your lab results, and so you're looking at them going, oh my gosh, it's not normal. And in the past, veterinarians haven't had to deal with that. You guys weren't asking for copies of things. You weren't keeping your own records and your own notebooks with all of your animal's history and results. But we do recommend that you do that so that if you, one, have to change veterinarians, you need to get a consultation with someone, you have to go to the emergency service in the middle of the night, you've got all that information. So you should always get copies. Somebody either emailed me or posted in the group that they asked for copies and were told they weren't allowed to have them. Wrong. You are entitled to a copy. You're entitled to a copy of records at any time. You can ask for them. You can ask for a copy of lab results. You can ask for a copy of exam notes. You are entitled to them. You paid for it. You are entitled to that copy. So the other thing that can show up as abnormal on laboratory results for young animals is the alkaline phosphatase. So ALK-Phos is a non-specific enzyme usually associated with the liver. So it comes from 4 places. It can come from the bone, it can come from the liver, it can come from the uterus, and it can come from steroids. So generally our young animals are not on steroids. And when it's high and it's related to the uterus, that usually is associated with some sort of uterine infection like a pyometra, so we don't want to see that. But let's say you have a male or a spayed female, and you're like, okay, it's not coming from the uterus, not on steroids. So we've ruled out 2. Now we need to know, is it coming from the liver or is it coming from the bone? Oh, sorry, it can also come from the intestines. So animals with IBD or inflammatory bowel disease or vomiting, diarrhea, for whatever reason, will commonly have a high ALK-Phos. It doesn't mean the liver is crashing. It could be that the intestines are not happy right now. For young, growing, particularly dogs, more so than cats, but for young, growing animals, the ALK-Phos can be high because their bones are growing. They're going through a lot of changes. So a high ALK-Phos, a moderately high ALK-Phos in a young animal in a pre-op lab, perfectly normal. Not something to get excited or upset about. So we need a lot of information when we're looking at the lab results, and just posting something that says, oh, his ALK-Phos came up high. Well, if you don't have the age of the animal, the sex of the animal, or medications that the animal is on, because medications can cause that ALK-Phos to go up because it's causing swelling in the liver. And very commonly, one of the first signs of Cushing's disease is an elevation of alkaline phosphatase, and it's non-specific. It does not necessarily mean the liver is crapping out. It means that we've got to find out, why is the ALK-Phos high? Which one of those areas is it coming from? So it's very non-specific. If you get lab results back and the ALK-Phos is high, and your veterinarian immediately says, oh, he's in liver failure, don't buy that, because it could be coming from a lot of different areas. And it could be coming from the adrenal glands producing too much steroids. So remember I said steroids can cause the ALK-Phos to go up because it causes swelling in the liver. So if your dog is not on steroids, but maybe they have a big adrenal gland or a pituitary gland that's telling the adrenal glands to spit out too much steroid, that can be the cause of it. So it takes a little bit of detective work to figure that out. So, okay, that was a lot of information. You might have to go back and listen to that one again. That was a lot of information in a very short period of time. But the bottom line is lab results can vary depending on species, age, sex, spayed, neutered, or intact. A lot of variables go into that. So you are entitled to ask for a copy, and you are entitled to ask for someone to go over those lab results with you. My technicians at my old practice were very well trained in what those lab results meant and what the different things were that we should be looking for. They were very good at discussing with clients, what was going on and what we needed to do next. So why do vets give Pred for inflammation? Because it's a great anti-inflammatory, but there are other things that we can use as well. Can the steroidal eye drop make the ALK-Phos go up? It really shouldn't, Teresa, because that should be staying pretty topical on the eye. If we use enough like ear drops where it's being absorbed through the skin, we can see it go up. Not that common. Okay, everybody have a wonderful day.